May, Bertia. Tor. Pekkel other belaw. Kasus rigid ma ibudul ma raklay ma rubugul belaw ma pilum ebi raklay ma masil belaw. Ma bekkel other belaw mar alsela blur belaw ma ikler belaw ela alsils. Irigan malungil litasils and morga president ra senate. Irigan rugul senators speaker Anastasio ma rugul delegates. Irigan lamugad ela alsils mangal tangata uk Ontario governors Maria Dr. Mais Roberts Governor ng Nui Governor vote adirigal Ontario speaker sa artela bangyada adirigal speaker ra malgayok madirigal speaker ang artmaw kumangay dirigal vice speaker Blue Orior well dirigal kadamal mereng asula la factore dirigal ira itay labang kita dirigal litasils dirigal mal mereng asula la media labang kita ngartiang mesang ngartiang tiabelaw kambes dirigal ngartia TMC awak dirigal ngartia Mr. Telams ra PWFM dirigal Bernadette ma lay ra Island Times mal misulangan labang kita dirigal sils dirigal malungili tasils morga vice president minister Matul minister Jenkins minister Obiang ma dirigal postmaster general Asanuma dirigal malungili tasils minister health rasa kala amlam mo etel di tia tamel kluangar alede giredel dura adra blu giderel alsilsa dirigal malangan tangat dirigal toktangal bela abang gedela Governor Dr. Amais ma dirigal nira ite Dr. Yano di dirigal nasabela blu ramrigel lo wisel mesel del willer gid uk dirigal modongal tril toktangal blu melding gid Dr. B Dr. Bostrom ma Dr. Hancock ang artiang atamlera kasus mato bangyade uk moniate ledel el smada gel current situation na balwat wasem el aldoral budulu ngara telel malungil litasil se speaker airai oi welcome bye. So first of all, good afternoon, Dr. Bostrom and Dr. Hancock. We are extremely grateful for the great partnership that the United States has with Palau. And especially when it comes to health, you have been at the forefront, not only providing vaccines, but providing the technical support and helping us in combating this extreme challenge that we've been all facing. So we are just grateful for the quick response by the CDC to be here so quickly. As you know, the cases in Palau began to spike, and just recently, and having you here, I think it is important for the people of Palau to continue our understanding of how to combat and to protect ourselves from this very contagious virus. Um, Especially understanding the virus, understanding how to mitigate, understanding the best responses that we can do as a community, and most importantly, how we can all be responsible. Because as Minister Gafar and our team at HHS here in Palau, they can only do so much. And we have to thank them for their extremely hard work in keeping us safe. But they cannot do it alone. And it really depends on the leadership and most importantly, each individual citizen of Palau. Um, Especially those returning to come and visit us. So, as a role model, Dr. B and Dr. Hancock, you're wearing your mask. We're all wearing our mask in this room today because that's what we're going to announce today. The national government has taken the stand that we'll mandate masks in government buildings. But I think that there will be a health directive today to take further measures and encourage, not only encourage, but require a mask in every building that's indoor. And the minister will brief us on more of those measures that we need to take to continue to keep our people safe and to better mitigate and manage this pandemic. So, ti mongutel te alle mal di mrenga sula blom regal matel to medal del wil rigid ma ule tirgal to go bet lok yak sang rigid o malungili tasil se doctor senator Quartey doctor Quartey mal msaul me join rigid la li tasil rigid mal mrenga sula la blom regal sel to go bet sel del wil rigid ndegal di lo durok la vaccine manges wel mera hospital rigid mar adam temlay itigal terul tiro man gedre al jil se doctor Hancock ma doctor postur ma do dong tri te bro mei sel tal laboria e wai gay del lomsad tamam to nga se orgid raul das e ko ai se gel roru legal baby rablul mle kargid ma yuk plabol si se bringi mi gida se dro mesa se ma uk tial bal wadra blur belaw kada magra sel ba akla e magra mara al budulu e sel gotru il tretal logi wai gel lomsu ma mara lu il tretelela aurere kita mal mereng asule la ati mergi drai osi ma minister mar adro hospital rogui ramri lu rerir diga dire al moklor mut sel le me tirgara de doctor yano tu mel mosugid meskida yu pesul da sora gel ukloru regal bebi rablu mal sumen di wile de por seguid e bai bok pastriate al mo bolong do du e gulitra bodolida tigingir abolong do du komal misulang e minister paskaula
Malungil talyal sils mamsulang Mr. President. Malungil talyal sils mara President ra Senate, marugul senators, Speaker of House, marugul delegates, mga ministers ngatiyang, direkal adra media, mamsulang ang nilugul. Matingi Mr. President, tala sa balua mal klase bakrengaringi. Kada kuk mere lal sils, kuk stereo update o sisil time Stego wegel blam tu kono mestira te alla tikal okya kargid nara citizen may polo ay sergi degel bukora ablal west regal bebira blue tegid toguni tegid el omicron variant el gida omdas lo se segid ya amdas oy sobra alwadar belaum o sisil time kadulungit tetil may metamo sa gel buk talang tingil aurelet lo me sa gel gukora sa paedel smisi e gutmok le kada mending yo set tiam lami namo sa gel time gel dal gimer lo sem lami guk mor se next el mu se next el bar se lo sem magrada do malas men roba pridel al se la blue e sa ba ak tirgel tira asabiin mal mosme ringi sa gel yamal mol mal objective ra ministry ra health ma human services Egi daw tuira tiragal toktang rigi dir ngar belaw tiriga gi dir guk experts el ngara citizen may direk lo sisil time waigal tilung ako da malas mal lomesel wase makarang ato rur tial operation la covid response al mo wal bekal sils el teletele la urir a hospital le waigal tilung ra tela club siram la memong el alta me kamam rokui el other hospital awagi dim albangat tiang tirigel kuk omgar sme yung ngara word at tang la adiakal ultimuk regel urior el angara tokora covid hindi direct tirga direct di adal wagi dim tamla sois bra adak talela tial rakta mang direct suadalo ngit tirgal sa lidal wasa el alangat tiang. You are here for 2 weeks, if I'm not mistaken. 3 weeks, okay. 3 weeks, tanga tele del Sunday, direct el mongo sugi, de segi de lo mes, lo hace magra gukto mes ra angru el trebsay, yan maral melbuy, lo hace magra abodong utmok at tele laurior, make sure guk other hospital sabi il masabak at tirigel tirangan yars dimlaraktir, may gel routine and services sa hospital. Kasi sitay mga yar terung al diakal tolor gid al direct kalmera kasus guk Marcel al Asper branch sa human health and human services sa Mitigation dirige direct kalguk momes sa facility ra hospital may rokul guk ta agel tospe elomkar dirige man mo hidol smera covid make sure agel rokul tospe ang armi o urio dirige gid mera kasus direct itirgal terul ruba ka tigat terul toktang adon teril Dr. Brostrom amlera last year ngara onge del buil sera March ngi meset cloud team ra HHS mlen nga sergi del marus ra vaccine mora o mesin de set time at tamle makloladan nga niya raptir ma tirigay del no underlying conditions among welcome back Dr. Brostrom. We thank you for joining us again. Masisil time Dr. Tain Hancock amlera August ni Dr. Cash idam tingin sa August 20 inyam lo nga get lol el hotel gays el mesoy sa Palau sa el August 20 mo de direct lo sa pedro ngit team tamera August 23. So thank you Dr. Tain for coming back again to help us with this phase of this pandemic. President kadamdangel wasem padamal ngat tangat lang namo erurakal el de selva ak umasin rablu lata dimle talbuy la lopri de tial rak rablu lat etam lo sois bara sel dingelel lo klo ko dal men mitelatan idang tangat talaga la selva ak la rurak e kol elang eng katigital na mesal na sois mangungil hindi kita madingil se tegi del dak ay gal batokal bulu am lamo tamlamos mauring Masayid ako ti imol kantil sel da salba akit man makatek the time. Lingwal dil at sel al Sunday. Ngayon roguil. Lol sis beringa igal bebi rabulu la al sel erurak. Aba ata sis beringa di al sel tal Sunday imol bulu. Mang sayid aring la laudior direct kal sebok kreng au tur sayid. Akda kay nga sew. Tirigay tirigal toktang men nga sew gid. Timug tulol ngit la sebon mo klor mo. Magyokogit. Direct kal sodal wera da istira te ala dim istira ada update ra kuk tokora cases makantak sa al sils so tingin sa eli tilo da situation report tan lang ya dim le imol positive eli malmutra 10 o'clock ra kasus dim le wana positive case yam le contact emlo positive el al sils el mutra eruklok el alita sils namon nga 6 el positive case 6 el positive case el tiram le contacts nara quarantine em mo matang al positive elim lang niya imol suspected case malum probable case el atam mo terum ka pending a further testing mungwal to date since August 20 2021 mo 46 cumulative cases el at time nganya 32 active cases el ngara isolation facility Manir 14 na recover da malupit na mo yakal buko yun na release certi malmol mga nigid kaldel historical case condition tirgal 32 active cases el al ngara isolation o masin de tira dia ka symptoms certi the asymptomatic tirgal the style nga niya symptoms certi di ka mild di ka kora bring la tatingir man nga niya ongit Ora makul o morokoli hindi ka katartir el mo uspe el mora gurul amin mora mo yuying malubong uspe akarul tial rak tadi malatay lenol direct katara swadal kora smodi raw era da toyula te al mortir kal toktanga toka adalu deng wan mel wase kama magi makra eko test swadal mutal kataklir sa ela time ang talgibal ng song sa test kits mendiakal sa ela mga tmok ra community testing Miguel test del dollar per el anga amort dirigel madang alo set the close contact ya uriora malmon may seguido el contact tracing at suguma ada madang alo sen close contact te seguido kita may test direct el aradas te dirige sa ilmora private clinic al sugum sorry mo test Miguel clinic el ngaringa testing ring hindi ko tolongit tarar adal wase sugum ka el altam sugum ko rasmer kera blim la mo mais mo ngoroy de kara adal smer Egitongin at test kits el lada bus mamaran may sisit time ako na reach out tel mara bebira partners sa gid malamut tel bebira test kits sa gid ako kora dangaring iri at time rat ko testing berektik kun mo ri sa gid bay da pastira te altir kal toktang mal el bukol sa da gel me sa dal belo south maro ka real tulog tel continue
Sudah Mr. lo mo ulan di sokal lo ay siro ase sel bleda announce ni lo ase kada mo tobra kotulurio leadership meeting el mori arbek la dame ra mayong adri ka man mol ra taklo ka ra kotulurio tiang di dere li le kada mora lo ase gira der mugudo mo lo ay siro da lo ase kada gira gel amra betul gira gel so tido maktat ka arbek la sulang.
All right. Hello. Thank you again. I'm Thane Hancock from the U.S. Centers for Disease Control and Prevention, and I want to thank Mr. President, Speaker, senators, legislatures, ministers, and members of the press, and most importantly, the folks of the people of Palau. That it really is an honor to be able to be here and work alongside you folks during this next chapter of the pandemic. For all of us that are able to come and work with Palau, you folks have been amazingly successful in responding and pivoting to the threats of this pandemic and working together. And this Omicron variant, as I mentioned, is a new challenge, and it's different from Delta variant, from Alpha variant. And there's two parts of Omicron that or two parts of it. There's one part that is what is going to be the biggest threat for Palau, is that it is way more contagious than previous variants. It spreads very easily, and unfortunately, it is successful at spreading to people who have been vaccinated. And Palau's amazing vaccination efforts have been successful at keeping out Delta variant, but with Omicron, that level of protection is reduced. However, with vaccines, as we know, one component of the vaccine is trying to prevent transmission. The other part is trying to prevent severe illness and really reduce the chance that if you are infected, that you would need to go to the hospital and need additional care or die. And thankfully, it looks like that these vaccines.
So, Dr. Hancock, just for translation purposes, we'll try to keep it short so that.
Or Dr. Yano has to translate for me again. Okay, yeah, so the other component of vaccination, one is to prevent transmission. The other component is preventing severe illness. And with Omicron, it looks like our vaccines are standing up and still preventing that severe illness and reducing the chance that if you've been vaccinated and boosted, the chance that you develop severe illness after if you catch Omicron is still reduced by the vaccines.
Media, Dr. Hancock, Ulsus Rabeklat, ولو أيسك ناسن مالت مارمولو بنجد ndi sira ongel buil mer elang ngaringa bes el variant igel wara tletele langkal coronavirus lang kodoring mong Omicron ngkal Omicron na ngod mal buguyuyul emro mong direct limur ar adel na moringa vaccine tumla vaccinate din direct sabihin mo smer milogok mo vaccination may kal vaccine ra dulay aul kabay ra tiangkal delta mendakal bukuy mendakal yun hindi akal Pfizer Omicron a vaccine adangay hindi direct dirga sa bedel mosmer sa bedel lo liu retial ser mura tamatang. Okay.
Thank you. So, because of the contagiousness and how rapidly it spreads, we have seen in other places across the U.S., and places in Europe, the number of even the best healthcare systems and public health systems to try to prevent transmission get overwhelmed with the number of infections. Just a lot of cases. We're seeing it in Guam right now. And so what that means for Palau is that Palau needs to really start to adapt and think about how you're going to meet this challenge of Omicron. And that's what we're here for. And one of the things that we've seen with this virus and all of the SARS-CoV-2, the COVID virus in general, is that the people that do the best in responding to this infection are people that the communities that can really work together. This virus tends to divide people and use that division to allow gaps where it can continue to spread. And so I think for Palau, with this new chapter, it's really going to require everyone in Palau to all play a part in helping address and respond to this.
Take the Omicron variant and malbuguyuyul amla America rablura Europe mablura American direct nat maut rablura Guam etam tigringil mal those pe ra blue mal motmak lesel sugum bli a blue en yamom bring la the respondel moringi tirang artial lobungked el longesera ministry git el longesera moral tleta la podogiungi.
So what everyone can do moving forward is one, the fact that Palau has relied so heavily on the vaccines really provided you a lot of success with the last variants, and also is going to help you protect you against Omicron. But if you're not vaccinated, if it's time for a boost, it's good to go ahead and get that vaccination boost now so that you have a lower chance of getting severe illness and winding up at the hospital.
متأكد Omicron variant بلاو ngultangat ling betokar adam nama yobo betokar other belam nama yobo di تأكيد Omicron variant الموت require mo spell dolaigel tirgel dimla lola vaccine amaya yobortir mitirgel ngila there's the blong amoma booster seguid longedera orus asobo kli ndera bolse mon New England hospital.
The other thing that all of Palau can do is when you think about those two components of the vaccine that we want to work, one is the contagiousness, one is reducing severity. The virus has snuck around and is more contagious. It can infect people who have been vaccinated. But one way you can help augment your protection against catching it, and potentially if you're infected and you don't know it, spreading it, is by wearing a mask. So by everyone wearing their mask, especially indoors, is actually kind of helps augment or improve that one part of the vaccine that the virus has tried to skirt around from. So if people in Palau, as this mask mandate goes out, really think about wearing this mask is actually in a way like a vaccine. It's helping you prevent from catching it and also spreading it. And it really is going to take everyone as a community to all really engage in wearing masks to help protect themselves and others in Palau.
متأكد الثلاثة الأوميكرون المالبقويول إن كذم لما يوبر جد دي ترى رولل إذا ذول كباير رجال تيال سير أذو سبع ماسك تيال ماسك ngosu kau adlo sparingi direct ngosuirin kel admin dakal lomer ketal ser melkoit mulasesel al ngaringa rolel ebo betok la adlo spe amask togonis el sum ngaral selablay al ube kata tolorar betok la.
And then the last thing I want to emphasize today is, as far as what people can do, is know that this virus moves fast. It moves faster than our systems to try to contain it. And because of that, you might as well be on the alert now. And if you're feeling sick, it may be related to this Omicron variant. And so we need people to take action now to really be aware, try to get ahead of the virus. And if you're feeling ill, don't expose other people. Stay home. Don't go to work. You know, don't if your kid is sick with runny nose, don't send them to school. This is a time that when people are sick, you want to isolate them and really help reduce the chance that they are out spreading this virus. And it should start now, that people are really aware of their symptoms, and if they are feeling ill, avoiding exposing others.
متأكد الأوميكرون عمال مريض الأمريكا من بلويل الديمام ذالن إن أوبرغر بلو وإرا وطورا وجرول أبلال لومول التمرني مولنيت ناسني ديل هذا المسمير الراتريت المالوبين سمير بلو لوسيغال دولل اللولنيت ملاغل لومايس مالوبين تو المورابواي السبيل لومير قتيال سير المورابيبير هذا بالكيرابلاي دينيل تان وقرا سيلف كوارنتينا تتل.
And so what we'll be doing while we're here is, as mentioned, we'll be working with Palau to really try to adapt and enhance the systems that are in place to meet the new challenges of Omicron. So that'll include looking at some of the containment strategies, the contact tracing, isolation, and quarantine, as well as looking at the clinical preparedness for Omicron, because things are slightly different and want to adapt those systems to meet that new challenge. So certainly this is a time where I think the community can really work together, try to focus on that unity, but be aware too that it's going to require some changes in adapting as you guys move to meet this challenge. And so be aware that, listen for updates from MHHS on new guidance and those sort of things. But I think there's going to be a lot of opportunity for Palau to enhance and adapt the responses as we move through this. So again, just as we go through this, want to encourage everyone working together, recognizing that we're all in this. Everyone has a part to play in helping to reduce the impact of this Omicron variant here in Palau.
ملغوت تملي الملاسم المسيور Ministry كده Health مع Human Services الجوك قميص هيكل تلاتة الجريل موضة التراك راتتلي لنقال بأس الفاريانت راتغير برجيل را public health دين ديريكت التمول مسيور أدرا أو جرول الهوسبيتال جيب منغرال تلاتة لسبيل مو وقوقو أيس مولسيس أقل tirgal adadra hospital mong mo sabihin mes emro kong respond mortial besil letail dangaringi sorry mo ural labantriar adra health adra clinical mar adra public health.
All right. Well, thanks. And my colleague, Dr. Brostrom, is much more eloquent than I am. Sorry, you had to hear the spiel from me, but he said he'll wait for questions, and you'll get to chat with him.
Okay. You sure about strong? Dr. Thane aknasin ba olgyung lobalam sa lidra Dr. Bostrom hindi po biria bay ngaring ager ngara media bol sebe longer.
I guess ako dala mamoragir maruko sel budo merege budo ay sagil talang tingin lagi mandates and mo take effect rel alsils.
We have a lot of questions, but thank you. We're glad you're here so we can have this opportunity to post the questions. The Omicron, we can see that it's spreading quickly here in Palau as it is in Guam. There's been comments or requests coming from the community that it's probably better to close down the border and clear it up before we reopen. Do you think that would be a good solution to this, or should we just, learn to live with it as it is?
Thank you. Thank you for that question. And so the question is about whether this is the time to maybe shut the borders down completely, because there's Omicron in Guam, there's Omicron in Hawaii, and the risk of bringing Omicron in is higher than right now. Your policies that you have are strong, some of the strongest in the world, but Omicron is very tricky. And so that's obviously a very local decision. Palau has made great decisions with the ministry and the executive branch and the physicians, the esteemed physicians who are here, made great decisions for Palau, sometimes against recommendations even, and very strong, and you've benefited from that. However, I think with Omicron, it's so infectious that the type of closure of borders would have to be very, very extreme. And most importantly, that horse already left the barn, as they say, right? So I think you have Omicron here, and closing the borders may not bring you much advantage at this point because Omicron is here. It's amazing to us that it's already January 2022 and you're having your first cases. We would have thought this would have happened long ago. We thought it might happen with Delta, but it didn't because of your strong policies and your community support. But I think for Omicron, as Dr. Hancock mentioned, it is just very different. And if, again, a very local decision about closing borders, I don't think it will help you very much at this point. I think Omicron's here.
So you keep mentioning about Omicron. So has there been tests made that we have detected Omicron in Palau?
Thank you for the question, Bernadette. So as you know, we do not have the capability on island to do sequencing for samples. We have prepared 16 samples from the first cases since December 27, which we'll be sending out on the Sunday night flight to Hawaii for sequencing. But I think the doctors will agree that just based on the characteristics that we're seeing with these cases, we can safely assume that it's Omicron variant.
Did you have something that you?
Oh,
I'll ask my question after you.
okay, sorry. Yeah, and I was just gonna add, as Gafar had mentioned, that the right now the number of cases in the U.S. Of COVID-19 that are caused by the Omicron variant are at 98%. So, it's the dominant virus outside in Hawaii, in Guam. So your cases are matching the surge with Omicron. So we'll wait for that sequencing, but I think again, it looks like this is Omicron, and it's best to respond as if it is Omicron.
So my question is, with the horse already left the barn, is there like a predictive model that can tell us, like by next week or by the end of the month, the trajectory of the spread?
Thanks for the question. And so there are models that could tell you what to expect. Models that are based on what happened in South Africa, models that are based on what's happening right now in New York or in California. But most of those places have already had several waves of COVID-19, and you have not, because of your excellent work here in Palau. Most of those places, all of them, have less vaccination than you. You're one of the best vaccinated countries in the world, and this is when all that hard work is going to pay off. They'll really protect a lot of the elderly people. So we're watching what's happening in Guam, because that's a highly vaccinated population, also with lots of comorbidities like diabetes and obesity, for which we know Omicron is also dangerous for. Those folks especially need to get their boosters as soon as they can if they have not gotten them in the last 5 months. And so the information that we have is pretty limited to what to expect. What should the hospital expect? And then what should the community expect? So we don't really have good enough numbers to share, but we are working on that. We have a modeler at FEMA who's already also trying to help crunch the numbers. But again, Palau is a very special place, and whatever models that Omicron has demonstrated in other countries will probably be different here. That's one of the reasons we're here, is to help the ministry be able to anticipate what might be coming next.
Mr. President, Gorasuado rong sao e rong sia Ministera Health, lo aisak mo kida ka ngara phase 2, malu ka ngara phase 1 tial. COVID-19, southern mong lisa kita dur ulela li receiver belau, ilgirel tial COVID-19 ilalata.
Ano sulang Mr. Talams. Kung das at time, aware po ko sa phase 2 Kung das ang close to telela, po tengilo sa self plan bla to bedi. Sa paedal mo dai sa edal mo dai ang idil time mo atera situation. Ul terul toktang o bunget. Mong sa edal sa oy at time lamo gilid more phase 2. Dem lamo ringia oy wadela rak tara adal dimla kan ngor omrail. Mura tara adal dimla kan omrail. So Akmadangelo sa igan nombre kaltelat club sa kadaman ko idar sa bulgula community transmission versus a travel related case. Obviously, ngiro ko ultimo travel related case. Hindi at time tuy regal blandu tirigal tokta megel do dangi. Ityang mo approve. Nung atidil ko ra cause of panic hindi sa igi dia reality the facing. So at time ang wal gira more phase 2. Mang ngani tablong malubang kaldel tablol manday tama imol malkura klolongit el mara adra blul bodo dura el alsils el ngia omu sa igidil tetelela riol gida del mutmok ngir rogui el gida tiang. So muta mo katakli na mo gida dan more phase 2 el alsils. Nung era po damre kada mo announce sa gel Monday tem sa gida klolongit tulwase. At sugo mo kasmer el at time mo takang anda ka mo mais. Kira blim. Egi tongi lagi gida testing. So sa gida tangan gida el at time. Ngay sa el alsils sa gimo revise sa directive el mo mandate ta mask ra rogul indoor spaces. Mo mandate ta mask ra rogul indoor spaces. Maige londi pra yik el gatherings el ngara lui el other morbo. So we're gonna mandate mask indoors except trablidi are out of course. So marugul restaurant, marugul siobay, marugul office, school. Agire talo mask ra alsel. Gel gora maklo londi pel ngara outside mol timuk rarwa kamaldil mangat. Agire talo mask ra ngari. Posisil time selong irung ako mo practice physical distancing. So kung mo tel more sel bla ringit teletara lokot telo mo tel pandemic, and make sure I get roguil kingal ma pasyon mo niya undi ata the space out ra ay gigil nga rin. Hindi sa lomes sa gigil phase 2 yung sa edel malmon may get rogul doru ra bekkel sils. Sa gita direct gigil mo kataklilo sa el at time makadiri ko tour sa gigil was in dia ka close sa school at sugum mo niya guys rawan el class e ko focus sa gigil. Nung kora talgi bil amo obrao del mora adalo ring sa tiang di sa gidi plan ergi yakdo ko komes ring ya sugum nguk man mo hido el wangrang yakdo ko more sel next daw sel next step bakmuto mo katakli oy kada ngara phase 2 el ang e gel ko tel bodol ngit ring ya atara bulu ak mo Thomas kaya gel bekel indoor basyo e maro ko ma yik la sum kada ngara maklol ko on dibel malubong activity including our one night market ma egel block 2. Kasi si time kada mo practice ra physical distancing. Yung move talo o ngit ra adalo sa po mga orus. El alsil sang open up path. Namonia orus ra pediatrics el 5 to 11-year-olds el start ra Monday. Direct kal mlame Pfizer matirigel maklol adalo. Sa edel mo malago a booster gi. So orus adir kamaran may sa all group masong sa kuluguk mutal malay. Lagi dah ako ngit talaga.
My question is to Dr. Bostrom or Dr. Hancock. There's how's the Omicron variant compared to the other variants? Do you see is it stronger? Is it weaker? Is it what's your outlook on when you look at Palau? Because I know in some other states in the U.S. things aren't going as well, but some states are. Are we doing enough to be sure we're on the right trajectory or not?
Yeah, I think, and I'll let Dr. Brosham say a bit as well, because you know, I think if we both explain it different ways, but we're finding that the Omicron variant is much more contagious. It spreads much easier, but it does look like it's causing less severe disease. So of the cases that of people that get Omicron, the percentage of them that require going to the hospital or even having severe illness and dying is much lower than the other variants. So some of it's good that severity is less, but unfortunately it can spread so easily that it infects more people. So even it's a smaller proportion in some places, that's representing a lot of people that are going to the hospital. And so that's why we really are emphasizing one thing you can do to reduce that severity and really help protect the hospital is by getting boosted, especially for your most vulnerable people. So people that are, you know, older, people that have diabetes or are overweight, they really should get boosted if they're not. So that helps reduce that severity. And then the other thing is for the contagiousness, as we said, some of these community mitigations that you can do by wearing masks, being very careful. If everyone in Palau can be careful about situations that they recognize are unsafe. If you're indoors with a lot of people with the mask off, that's a dangerous setting, right? And if you're outdoors with a lot of people and it's really crowded, and you know, that's another time that you would want to wear a mask, because this virus likes to spread, from our mouth, from our nose, across to each other. And so those are two things that you can do to help really mitigate the new changes that Omicron variant has compared to the other variants. So one of the other things, now we're constantly learning about this new variant, right? And so some of the things that we may say now, they'll change because there's a lot of new information coming out. But there is some early evidence that's showing that this new variant tends to be in the saliva more than some of the other variants. And so certainly in Palau and across the Pacific, where people chew and spit, that's another thing that you need to be aware of, is that saliva, that spit, could be carrying the virus. And so be very careful about your chewing habits as well at this time.
Thanks, Dr. Hancock, and thanks for that question as well. So as Dr. Hancock mentioned, the early information we're getting from other countries, it does look like Omicron is milder than Delta. Still a serious illness, but it's milder than Delta. And we can look to see what Omicron is doing to the hospitals, and can go just to our neighbor in Guam and look to see where there are hundreds and hundreds of new cases every day of Omicron. And people with Omicron are in the hospital, but the rise in cases in the hospital has not been nearly as high as everyone was afraid was going to happen. That being said, it's still early, and it can take several weeks sometimes before people who get mild disease will end up in the hospital. But so far, it looks like it is still serious, but it is milder. And that's part of the reason why the rest of our team, who unfortunately is not here right now, is because they're going to be working at the hospital, looking at the oxygen systems, the ability of the hospital to handle several patients at once. They're also going to be looking at your medication stocks to make sure you have a safe level of the medications that you'll need to treat patients that may come in with Omicron.
Minister Werbelauer, le mentioned earlier nasin Kasaya testing kits. Total aga soril mamlakter teselan the available material frontliners, material public health employees. Ngami it's rather selit ng usay giran taxes and testing.
Say malungin ker ngoy say ngaringa kmay the lewat tela le teskit sen maran may gigi del lado order gigi da mlal move del longit trar salid del may der gigi del wasel sebel lo duro club togra bret tan hindi kal segel mur el allo sing maloy ngarang hindi sel gibo mo tingi se egi mo announce mesel bol ta announce se mo OI sa sing morgera testing mo ngana tele
Minister or any of the doctors can answer. So what does this mean for the younger kids, if you haven't answered that yet? What does it mean for the younger kids who are unvaccinated and physical distancing might not be possible, like in schools? So yeah, what does this mean for them?
Yeah, that's a tough question. For the kids, unfortunately, we're finding that Omicron, unlike the other variants, can infect kids fairly readily or easily, and they can spread it as well. The good news is just like the other variants, it looks like kids, it's very rare that they get severe disease, and so that's beneficial as well. But because of that, I think there is going to be efforts looking at how to ensure that kids are going to school in ways that allow them to reap the benefits, important benefits of schooling and face-to-face learning, but in the safest way possible. But yeah, we still would recommend that kids, if they're eligible, that they go ahead and get vaccinated. There are still some cases, rarely of severe disease, and that vaccination helps that. And the vaccines do help with the reduced transmissibility a bit, just not as well as they used to with the other variants.
Just to add that, I know that the program here has also been able to make sure that the children with special needs are also getting their vaccines because many of them are more susceptible as well to the virus. But as Dr. Hancock mentioned, it seems to be mild. When we look, in general, this is with the Delta virus, but when we look to your neighbor in Saipan, they've had about 4,000 cases since their outbreak began in October. And there's one patient, one pediatric patient that was in the hospital and has since been discharged. So that's pretty reassuring that this disease typically is pretty mild for kids. But they should be getting their vaccine if they're eligible.
with the tiagid COVID la spike aurora public health svelo tugurtial el spike al sela gal mel few weeks al sum continue leda positive cases al sela gal mel few weeks.
Kasi sulang ra agi mo ongere o sisilta mak mo oidi yo olingit ra tirgal tirut dokta sabuk tetele legal belul wekker gidil seral sisiperte gidil la moringa gays na overwhelm ra other public health. So el at time atamam el ang ringil ul degeta kay gal kantak. Kami am dengel kom lamis ra si trip dimle imol gays teblol gays emlo nga radar tamadangil kantak. Gitelo mes ra gal kantak ta umesin dringi tirga kabol positive baby ringan na mo positive ding lasa edel assume lo sing el baby la mo positive so mal hindi ka role lagi mo tagi mauul misal number one messaging lang was tugtakang sugo makadasme ela ko domay sa dong roy dirgi dira adasme moring ya time ang mo daka enough room ra isolation facility matuguk mo imul mo ra isolate ra complete sige da kuk next gira dalo mesringi sige da reality wagel tilung hindi ka kateme del adjust matingin lo ser ada dir kamadak telo singara mga positive merero ra blue ding sige da reality. Unfortunately sa LD next week ikaday moon more sige al sugum hindi malmol ngani guys hindi maran mo ma kotuluria lagi akuk mo tabadi atara ako ra osisak kalwase sel the worst say gid face and namo gid del digit isolate travel at sumo the positive ngara mangara nga gid del merun mangara nga de gid del merun yung say gid next face hindi el at time at mama amal mering lo digit kay gal guys la di el sera terat club say em la mo dakat sa amal lotiri dik kuger tegi de lo sisigel mora Dr. Tain ma Dr. B Malkukul share agel experience ra pelura kwam masaiba le sera bol sisa pertegi del face. So Dr. Tain, the question is, how is public health's capacity right now with the activities and whether we think we can sustain it given what's the situation at the moment?
Yeah, I've been really impressed with the work that public health has done so far in identifying cases and quarantining contacts and that work. But as you guys know, that work is a lot. And everywhere else, when this virus starts to spread, it rapidly outstrips the capacity of public health to do all that work. And so that's where more and more, and you'll see across the US, we are relying on the people of the community to really also play their role and help with isolation and quarantine. And if you're exposed, being aware that you may have been exposed, and if you start having runny nose and stuff, don't go to that big family dinner or those sort of things. You want to stay home. So I know that public health right now is doing all that they can, but everywhere this virus has hit, it overwhelms those systems, and then we have to shift. It's a normal pattern. It's not a failure. It's just as you adapt to the different phases of the outbreak, there's a time where you shift away from that really intense isolation and quarantine contact tracing to a more community-wide mitigation.
Yeah, well, maybe there's no need to add, but we do see some real heroes for Palau, people that are have been working very hard with quarantine and isolation. Many thousands of people brought in safely, and they're tired. But when Omicron comes, it so quickly, as Dr. Hancock said, it just outstrips your ability to continue this level of effort. The staff needed, the hours needed, the hotel rooms that are needed, quickly just grows with Omicron to a point where you just cannot sustain it. And that, as Dr. Hancock very carefully said, that's not failure. That's just the next chapter. It's the normal progression of this pandemic, and it has happened everywhere where COVID-19 has affected the community.
And while that isolation and quarantine is an important part of the response, it's just one component, right? And that's where I think really all of Palau can really engage in this response by, one, getting boosted to protect yourself from that severe illness, and then wearing a mask so that you're slowing transmission down as well. So I think those are going to be really important moving forward for all of Palau.
Hindi follow up per se gitu garim Mr. Talams. Hindi akal bergulak mo gisto belorio. Hindi say kita galing itra coloring ra atra belum. Already agim na mamal tokon nga roy la ma sius. Galing itra say dito bulklor mo.
Mister, tadi ko di wilere del mortilang. Ngania, maybe our parents will direct them mo. Tadi concern the cell wasing tadi ngila instructions kasi ngal gibum el na radias el wasem isolated hindi ako follow up mortir kasi sibil murior yang kaninya bebira obis na close le ngaligi smear men dia kan sibil murior en tira ko logel kasi si logel kasi ngara instructions sa mo kasi kam sa murior ang ngadang igigida ka question sa blue mail.
Ang sulang yung waklet lagi dia kundas singgiram mo omis ni al silsil direct. El mo tapil wasing malwang rang at tele at sukum ko close contact. El al time yung wal true el klapse al sukum ko close contact. Ma Minister Education na direct el mo simbay wase el al time el ngara dartel el student sa ma asense ang ngara quarantine el close contact. Dindir ka kabol positive. Yung wal true el klapse dia ka school dia ka ngara school. Ma direct el mlabop to ka deng wal mail masada igagidil wase other employers na mo require a negative test result in order to let their workers come back. Nung ulingit ta sebas kama may alsil sa over the weekend de bodo bakat taklil waseng malwang rang at sugum kamle close contact ting telat club sale girem di ngarablim maluubong sa emel mawrior maluubong dia. Dibas kama matay mal bakat takli sa igit. They will say it'll move forward.
Okay. So we had reports of 2 years old a baby who had a positive case. So what are the precautions for the newborns and babies who are they required to be wearing masks or like and they have a regular appointment with the hospital, so how do we deal with those?
Yeah, so the recommendations for a mask are for 2 years and over, not for newborns. And so because of that, people do worry, well, what's protecting the newborns? And one thing that we're really encouraging is that mothers get vaccinated. So when moms are vaccinated, especially right, even while they're pregnant, if they're vaccinated and boosted, they can pass those antibodies that help that baby protect that baby against COVID-19 onto that baby. And it looks like, in fact, the antibodies from vaccines from a boost it looks like they do come out in breast milk. And so if the mom is doing, and again, we always encourage breastfeeding as something that is so healthy, it can even help the children as well, help protect them. So we want to encourage moms to go ahead, if they haven't been, get boosted. And of course, breastfeed your children, your infants, and that can help protect them as well. And then lastly is really, we talk about, there's a term called cocooning, where you're creating, trying to keep a safe environment around that child or vulnerable person. And again, wearing masks, being careful about, where you might go and what you might do to expose yourself if you have a child in the home. Is important. But then lastly, want to reiterate, we're one of the fortunate things is that the amount of severe disease that occurs in infants or 2 years old is extremely rare. And so that's good. While they can get catch this virus, the chance of them having severe disease is quite low.
Um, Minister, one of the fueling misinformation or fueling anxiety and fear in the public is the misinformation. So how important is it that there's a timely communication and timely information from the public health and from the government? And if you have any suggestion of how people can be well informed and not wait for information a day or two during this time.
Thank you, Bernadette. Obviously, it's very important for us to be first and to be timely, and to be credible. Um, that's something that we really need to work on now, especially with these mandates, and then moving forward, those re-emphasizing the preventive measures. But really, Bernadette, that they're all in the directives that we've sent out. I think people just need reiteration to encourage them. So we will do that. We'll start making sure we have more messaging out there. One thing that I do want to mention, and this is something that's I mentioned earlier, is sometimes we get caught up with the technicalities of definitions and uh, things like that, that we miss the point, which is please practice the preventive measures. I know when we're anxious, we look for more answers that are already there. But yes, the importance of timely and credible messaging is important. So we'll make sure to improve on that. I think we have to understand, even with the EOC, we're dealing with this just like the public. So sometimes it's a little slow to react, but we'll definitely work on that to improve.
Minister Werbalawa, sa domicile recent the positive cases and the travel related. Quieren mande como implementa el protocolo no testra tergerogul passengers arrivals sa airport. Usisul time que dergam le mention tergal health workers ahead already overwhelmed. Umamiss at continued flight and manageable and their public health ergid system real time.
Malungil get. At time tamarig dara testing ra contact sa mga outbound day 4. Hindi so far ako na manage. Sige del plan na ligida del kora omesringilo sa kada reinstate tara day 1. President tam na announce sa kada mo reinstate tara day 1 test. Magi mo kut mutin. di selguk suguma guerra kora Maral Bedula since edel bukko mesra egal skogi ase again di decision a leadership pendi segi da kukora to mesra ngil atan.
Sula Minister bilang ngari ako ratele menam ngadadura leadership ilgere la possibility musto kaskogi especially tial United Airlines lit tangani ara do sebagaran ri mutegi the spike asabel mo ula kabrementra Taiwan amo consider si travel bubble naman mo sabel mo affected tel medical referral gidar other bela.
Sulang Mr. Talam sulogar tira alger eli lori ate led el mitra ambassador a Taiwan. Of course at concern ti waigid trigal manangari wa case tira COVID and then dirigal ngari community transmission ertir real time. Mamle tingil ambassador abay mlara point wase igi magara help prevela. Already ngari anti del mortil wase igi ospera test kit e ospera af el melga se orgit. Como se sea importante el message ma tigal partners asaro el se orgit. Dirigal ulu aisana gal wase el Chinese New Year holiday el maral May reak med del darter tourist el sorin merbelam. Already mla tamla buga tiget tertir as of this time and riga plan cancel el flight. Igi damdena sing marcho da el flight al meleng or tagar smel mora guru le or tagar tilme. Tida do dongali. Tamla reduce ra idisira patient el accept tira el hospital Taiwan. Ngraul tediri lo mesa ukra increase ra cases tir met limit ra adal accept tir. Se de al gida ul na increase ra cases ra blura Taiwan. Mon ngoise gida malbodo baigar rogul toy o mesra se ngara igel se adal mrul ela gadiri lo mesra se ela la bulal sira patient en Taiwan gedro sender til u koya kwam en mora Manila. Lese other option. Mon kada malbodo o mesra I think we gedro diri lo mesra positive side. Ela al sils I think a minister na magatakli tige rogul cases ade gatertil ngar hospital. Oise disease masih terasa toba armel ding meet ut ngide ngaria a symptoms sertim malu bendia di ayamral mo tok se lo sa dri tikat tok tang ase ngaria telel morsel time na ngaria adal mo hospital already tiarak already mla sois beral sela blur belang moigel lugo Dr. Bostrom alimitra flight galel lagal saya a solution abay solution ang arale darbek la other belaw low mask practice ayel will practice ayel distance emalmol mal sumgo das mere di tang arabli da yigida del guru lete ya besel el tretal tang aralsel mong kada malmol mlomes of course ngari sel clone meeting ra leadership ra ablul berara Monday. Of course, I'm invited al Mercel meeting. Modal mutro ager el mutel masao. Dice el important el gumrani hasa tigar ruba ang artel help pergi ase melal doral bedulu mgara doru ringil sel gotrungil treta el gadome saigal ukngari capability hospitalir aigal bla doru rangara mol me maybe ngari gel gida del namo masamo kul mu ater ti al rakt gida para el alta igi gida dol mol mol mes dol mol masamo kul sulang rager.
I have a couple of questions, and these are questions coming from the community. For this Omicron, if a person acquires it and then gets better afterward, and recover from it, can they get infected again, or will they have natural antibodies that will keep them well after that? Or if they have other strains before.
Again, there's, thank you for the question. When there's evolving information that's coming forward, we already know that Omicron can has a special ability to reinfect people who have already had COVID before, different kinds of COVID before. We don't have any information yet whether if you have Omicron once, can you get it again during the same outbreak? Probably not likely, probably just once. But if you've and we also know if you've been vaccinated, then you can still get the Omicron. It's almost always mild. So I hope that answers your question. Yeah.
And other questions, there's questions coming from the community. The case in Saipan, the first case, the reported case of MISC. You mentioned that it's very rare for that to happen in infants. But people are reading, so they're kind of worried that, what are the chances of that coming?
Yeah, so MISC is a multi-system inflammatory syndrome that can occur in children that we've seen that it can occur after getting COVID-19. It is rare. It doesn't happen very often, but it can happen. And so, I think as parents in Palau, thinking about, even though it's rare, if your child is eligible and can get vaccinated, that helps take that rare chance and make it even more less likely to happen. And so again, I think, if you have a child that is eligible for vaccination, it's a good opportunity to get them immunized.
Okay, just one last question, and I think you've already answered it, but the people want to hear it from you. So in families, you have families where you have elderlies as well as children, and the question is, what do you recommend is a way to ensure that the kids don't go out there and they need to infect the other? So that's a question that's, I think, they want to hear from you.
Well, we do know, like all the other versions of COVID, that the spread in the family is a major source for sharing COVID, and there's information forms from CDC and from other governments that have talked about ways to protect people in the house if there's been a case of COVID in the house. What to do to make sure there's not too much mixing, to spend time together outdoors, more outdoors. It's really important to, if a family wants to be together, that they try to do this outdoors if there's COVID in the house. And so there's good instructions that we're going to be working on over this week, next week, to get the community ready for how to manage quarantine for patients in the house. And so you should look forward to more information coming from the Ministry of Health. In fact, we saw a draft version of that this morning already.
Maldi, one last question I was saying. I know you mentioned in the beginning that you're here to help the Ministry of Health with the plan moving forward and how to deal with the possible cases and increase, as well as other services that are being affected because of the increase in cases. And so that's probably going to come out later. But right now, Minister, if people are sick now and they need a service, but they're afraid to come to the hospital because of this fear of COVID, what do you recommend to them, or what should they do? What's the protocol, or do they just stay home and wait until it's serious enough to call? I mean, that's kind of.
I understand the question fully, and I know that now people are probably wondering I guess di mild la kong panic hindi kalswada ko tol atal mail di may malatay lenon for now o sisilta lagi ramal mo mesra ko ra separate tel clinic wa duluring ira H1N1 tirger roku ilkurangan ya flu like symptoms sa morgi instead ra mo raigal more OPD malung jaksal sure akuk private clinic ilwasing wangarang akuk maudru ulit tiang andi segi dagi kuk pomauringira flol hospital el malas memru segi di ora separate el clinic el giri adal ngania flu like symptoms eti andi segi di sukum el al time el ora mangan lam okla se bokreng sukum kuk ora di mild symptoms ergau el lagam spe emergency care malum urgent care ito las mga sa talabiset.
Minister, langara couple of months ago, قبل ما انت تبدي بيد المومنت موكرا contact tracing makora seseng el algorithm laber katiang seng aset el apply ngi mera community al ubang di ngara border maseleme kita mesti rai kay kiti seng ngawri lang.
Sulang ramalungil kere ongirung di Excel system dirga ka da launcheringi sel kuk mla issue ra PNCC ra kuk tara tokoy tara bit amlo affected sa igi wal dulngi sa igi dil kuk tara real makatmok la raw erabol sa mamal makatmok per say adi sa kal pungal lang sa igi dil system tolmol man mamalaring leng direct kal sa pedro speringi ra tokor wa dengue fever ma pagaraw sa bugoy rak tal kuk speringi ra igi dil egel features ringi apo speringi ra pagaraw sa even may ilang al sumo kada mo sa pedro ngura mari at that time sa edel no speringi gira la covid Hindi hal di ko kaya tiragalo sa way sa igit el system ang adir ko spaal regal baby rap. So the question, Dr. B and Dr. Tain, we were planning to start that contact tracing system using SIM card based technology. So the question is relevant or even feasible to continue to plan on getting that up and running? I did answer that it was our plan to also utilize it for other means, for other applications such as dengue fever tracking. But in other places, is that something that's still feasible to be used for COVID, given the Omicron variant and how it spread?
Yeah, I think it still would be something worthwhile for you guys to explore, even if it's, let's say, too late for Omicron and you guys have moved past Omicron, but we're not sure what this virus is going to throw at us next, right? And so I think building those capacities, continuing to build those capacities that are appropriate for Palau is important. They, some of the technologies that have been developed that look like they were going to be really beneficial have maybe not been utilized as well as they can, but doesn't mean that this one may not be appropriate. And especially, as I mentioned, it's good to have that capability for, as you mentioned, for other things or whatever COVID throws at us next. So are other places still using it? I think there are some places in Asia that are still using it. In the US, there was some effort to do some exposure tracking using Bluetooth. Guam implemented one, but they are not using it quite as much as they had hoped to. And part of that's because a lot of these technologies require uniform adoption across the whole community, and if only a small portion of the community is using it, it's not as effective. And so there are some challenges there. Yeah, Hawaii's got one.
Yes.
Sorry. Tel kera yakora may yakora kamil terul private doctors ngara services regal clinics kami wa Talungab. I'm sure there's a lot of people that would probably be coming to you or needing services beside the Ministry of Health.
Yeah, the services are the same. You know, we treat everybody the same. You come in, get screened, and if you're suspicious or, you know, been in contact, then we refer to the right people. So, you know, we're not going to turn anybody down.
Sulang ragir. Asmel al screening iram galatwang. Al sugum uspe a test and dingarat ay krela klinik at may test ringi. Al sugum negative and move. Al sugum mo positive ag yodruk lil mara public health.
Question for Ministry of Education, perhaps health. I'm more of interested about students' school closure. What's a benchmark, or where, at what level do we begin to look at this closure so we can prepare our students for distance learning and what have you? Because some of the elementary school are holding their kids. Facts are our sixth grader, we held him at the house for a couple of days, but he has to go back. We have no reason why we should. And we don't, it's still unknown. So can you shed some light on that?
As a result of our meeting this morning, the school also has a COVID mitigation plan that works in conjunction with the national plan. We are also moving into phase 2, which has the required masking, but goes into much more detail of things which we're going to be working on. Those will include, of course, the hand washing stations will continue operation. We'll upgrade our disinfectant use in the schools. We're also looking at the spacing of our classrooms in terms of interior, where they're still losing mass, but we're looking for keeping at least a distance of 3 feet between the students, having the desk face pretty much in the same direction, and then increasing the ventilation of the rooms with use of fans. And in the case of those rooms which are air conditioned, and trying not to use the air conditioning, but instead using air coming in from the outside and using fans to exhaust it out. Those are some of the things. Also, as we go through this, we're looking at the outside activities of the students, where we will have lunches. Lunch will be, in the cases of the larger schools, we'll probably be staggering the lunch periods and keeping the smaller numbers of students going into any cafeteria at one time. And again, the distancing, would that be? The essence of moving into closing the schools would require a significant change in the number of people who are infected, and would relate greatly with the services still available at the hospital for that. So right now, there's no firm number other than if in case the services of the hospital appear to be overtaxed, then we are recommending closing of schools, but we're not even close to that yet.
You didn't mention the transportation. You
but-
talk about the classroom distancing,
Yeah.
but about the like school buzzing.
Okay.
Do we recommend that we take our own kids to school, or you do the distancing in the bus as well?
Yeah. That we're also recommend masking while coming to school. On the buses, it is also required. And we're going to be working with the bus schedules to try and find out whether we can maximize the spacing of the students in the buses. But again, parents, if you wish to bring your children to school, are always welcome to do so. And the drop-off points will be different because the buses tend to arrive at a different time than the parents. Buses usually get in quite a bit earlier than the parents for the hot lunch or the hot breakfast program, which will also be looked at in terms of numbers of students.
I'm hoping I can just add briefly to that. That's a great question. And what to do with schools has been a problem for every community facing COVID-19, especially now with Omicron. The first thing I want to say is whatever changes you make, the one thing about Omicron is it usually comes hard and fast and then goes away. So the information that we have would make us guess that this would be a 6-week or 8-week event, of which you're just starting now in Palau. So whatever changes you have to make are temporary. And that's really important to make when you communicate this to the people who live here. Then also for schools, I think most folks at this point are finding it's better to keep the school open if you can. But some of that, as we talked about earlier, really means that the parents are going to be willing to keep their kids home when they're sick. Sometimes we wait for our children to have a fever, to be really quite sick before we would actually hold them back from school. But now things need to change right away. And so if a child has a runny nose, scratchy throat, this is the time that you should be very conservative and try to keep the children home and not send them to class. That way you can keep your schools open for everyone else.
Okay. Ngora lama mlangarak kre waklok. Ako dasang amla mo mereka agir media for now. Kita mutu mo meeting ra Monday. Mle soda alboniate lela ministerial direct muigel mo special changes. Yes, and much other things Senator Corte Dr. Corte.
May Presidente di Critial, question ng gamal. Nakarirak mo sa almong iarap labasay. So everything I've heard and everything I've read is that this is a mild. Omicron is very mild. We're not testing for flu. So why are we testing for the Omicron? What's the purpose of testing?
Thank you, Dr. Corte. And while the severity of Omicron is less, and we're somewhat optimistic about that, it unfortunately is still more severe, way more severe than our seasonal flu. And so that's one of the reasons why the focus on Omicron. But you bring up an important point, is that while the healthcare systems and public health pivot to this new threat, there's a lot of health conditions that exist in the community that can't be forgotten. And we've seen in some places where people only respond to COVID, and they're too scared to go to the hospital. They neglect their diabetes, they neglect other things. And so I think ensuring that people are aware that other health conditions can occur during COVID, and it's important to not only for the Ministry of Health is trying to keep things open, but also as patients themselves to make sure that they're keeping up with their medications, taking meds and those sort of things. The other thing is in regards specifically to the testing, there are some test kits in the hospital that you folks are, I'm sure, aware of, like the BioFire and those, which is a machine that does a respiratory panel that includes flu as well as other respiratory ailments. So there is some additional screening going on. But of course, you're right, there is that big emphasis on Omicron.
No, what I heard the other day and today and what I read is it's mild. Yes, maybe a little bit more. But you just mentioned that hospitalization is really low. And they're overwhelmed. So how come we don't just test the symptomatic people that show up? Why do we have to go and chase the contacts? Why don't we just assume that they're going to turn up sometime? I understand if we're trying to prevent people from going to the respirator, so we're catching them early. But if they're staying in a hotel or staying at home, why should we even bother testing? At least for Omicron.
If I could also comment to that quickly, Dr. Corte, and thank you. I think this is a topic that's also come up in other affected areas who quickly, if we start testing everyone who has a runny nose or everyone who's been in contact, they're going to run out of tests, and there won't be enough tests for the people in the hospital. So it is important not to over rely on the tests. This is a time, as we move this towards the community in the next couple of weeks, that folks are comfortable staying at home if you are ill, and only if you're very sick and you feel like you need to see a clinician, that's the time to come and get tested. So we're not quite there yet, I think, but that is where most communities end up pretty soon. We just looked at the school recommendations for the state of Hawaii, and they have dropped testing as part of their school. They're not testing children who are sick, and then after 5 days at home, they're not testing them. They're letting them just come back to school after 5 days, as long as they're feeling well. So I think that makes sense. It preserves those tests for the hospitals. And as we work towards these policies this in the next couple of weeks, I think your statements are going to be really wise.
Just quickly too, in regards to the severity, just a reminder, and Dr. Brostrom mentioned this before, that it is still early for a lot of these Omicron surges, and including like Guam and those places where, fortunately, we're not seeing a steep rise in hospitalizations yet. But hospitalizations do tend to lag by about 2 weeks from the cases. So, we'll find out. But you're absolutely right based on that severity and accessibility of tests. We may need to change to that. And again, one way to really push that severity level down and the hospitalization level down is for anyone who's not vaccinated, get vaccinated. And if you're eligible for a booster, 5 months since you had your last shot or 2 months since you had your Johnson & Johnson, go ahead and get boosted and help push that severity down.
Dr. Thane and Dr. B, I did have one question myself. What is the outlook on this current worldwide surge? We keep seeing that it might peak in the US within a couple of weeks. It's probably peaked in South Africa, in Europe. What's the global outlook on this current surge?
Thanks, Minister Farr. And we talked about this morning. I think only a fool would give you a guess for what's going to happen next. We've all been tricked up by this virus, and we will continue to be tricked up. But Omicron is expected to surge across the world quite quickly. I've seen estimates saying that by summer, they think even the most remote places will have surged with Omicron already. That might include some of our Pacific Island neighbors who have not had any Omicron yet. So we know what they're intense, but they don't last very long, and that's what we would expect to happen here if indeed we are at the beginning of a surge. And what comes after that is hard to tell if there'll be another variant. And we can hope, but we also need to very much prepare and learn from our experience.
Minister, maybe you can take the time and explain the mitigation plan again. The area la presenta Senate.
Silang President. So, waigel tilung, tungur said plan algida kutirak karingil at time and number of phase 2. Ya umasin raigel el domakadol was a non-pharmaceutical interventions, agigid mitigative measures or preventive measures. Umasin niya already kita mga marura bekal seeds. Agit tokor arwa barriers sa stawang mga obis ang aring mong el alsil sa igel mokot mandate sa igil mask indoors, mask igel outdoor gatherings 20 or more people. So maraming ige di mo karingi nakamaldil maomangat ondi ba yung ladi tin ko na maklol ondi ba kakaroos and sporting events at suko mga outdoors in 20 or more people ako mas sila ongero nga dalug tel mo reinstate the self physical distancing ra arokul basyo including ra outdoors sa ungin na tolas man 3 feet physical distancing sila nga day sa igiti el alla ka test kits at suko mo kasme please sila ka mo mais unless ka man mo hidol sme pura oguru Say kita don't get tingin at time. Move to lo maklat kala se. Tolmol mangutmok lagi kita preventive measures. Malval mangroy der karasme. Selman mo last study ka. Matingil wase ilang mungal mlan buklo sa bukring. Matraktra sila balu. Akmadil mo tulo ngitra. Aklo ring makleng sir adra balu. Adamam ilang overwhelmed. Kasi kim pom ay kay gitil patokon negative. Hindi akal help para kumaman put maklaw rin lang. Aktil mo tulon ngiter sa igit, ak maningiro sa tiagit sa tayo mandul ngiringi. Namo erurak, bato kam la chens, kadam lam rus, namo niya kakrus el kurut, kadam la kutmok la yagit el physical barriers sa igaro kulstawang, kadam namo mdul physical distance, kadam namo mdul o mask. By the way, seldo dulo sa mask, please lakal dil, multi game, malubal dil. Amol tangre mamong mask ko full lo mask do ko dagay skem mangarem namo erura kal beto ka bladru le chens adi imol diri ka chens tegi del dak maguling itlo se boto ngilo message sa igi sugun makadam lar mula mal beto ko ludiol dak dil gamam beluro giram la katakay ngisem la kut pakti del metegi em la chens ay igi del beto ko bladru adi imol diri ka chens tegi del se bokring mata makulingit sa sebol maklorungut tot terkok kergi dara rupa ebo da lelak leda kay ngisew di sa igit ako manusin
Dia malam sulang minister di awira dong simbre me kulingit waila igidel tokol blamtung amal maklaw tutlel aktiolingit me dapsate lela a Dr. Robert Madaktor Iano, Madaktor Cuartey, Boldu, Adilo Sisul Troyen Diungil, Digulingit Memel Tobrang Ritriga del Toktang, Le Selshor a Dr. Robert Ratutaman Lekla Impactringi, Le Optoisel Adra Blurbela, Sen Somam Ronsia Toktang, Etiraring Sia Dr. Robert Ratutal Manewil, Medoliter Tiltedem Bol Dugamenter The cell gumesringir elang egidel other below rogu a patient. We need them to tell the patient what to do in order to save ours. Mang miguling tertil tedem boldu kamen tertil mar adra blur below rings et tira sib il sob aklidelen gire de Lorenz tertil. Miguling te Dr. Robert Mbabong el bo Dr. Yano el bo Dr. Cuartel bolsib el coagilo armut balagda Dukura mangal mutul musimbal girel at tukul gidanga albang ringil al time. Senate Dr. Robert.
So, Senate President, Dr. Thane and Dr. B, thank you very much for coming back to the rescue. Thank you. Sitting here and listening, and I went to the talk show this morning to try to calm people down. Sitting here and listening to what's going on, I always like to simplify things, and I'm looking at the downside and the upside of things. And this is kind of what I gather, the downside of things, is still the same. Medical capacity is still marginal. Our manpower is still marginal. Our isolation sites are maybe overwhelmed. And test kits are in low supply. We got vaccines coming. So those are things that we can actually address, which is fine. Now, on the upside of things, I feel good listening to what you're saying. We're into this outbreak, but what I gather here is, on the upside, we have increased population that's vaccinated. That's a plus. We still need to tell everybody, those who are not vaccinated, especially the young, and all who need to be vaccinated, get vaccinated, because that should protect us. So that 98% is upside. Also, you mentioned that this thing goes down very quickly. That's good. So that should lessen the fear of the population. Another thing is the severity is much lower, which is good. So it should lessen the fear But I think the biggest thing that we need to keep stressing and tell the people is nobody has died yet. We have done a lot of these things that, EOC and the leadership and everybody is trying to do all these things to prevent that one death. And nobody has died. We are here now doing this. I think we're doing a lot of things right, especially, the ministry. So we should give them credit for it. People are scared, but I think we need to do those basic things. That we just talked about: masking, washing hands, social distancing. Those are the basic things we do, and we did that from the beginning. It works, but I think the message is get vaccinated, those who have not. Pati, mo gigil ito nga because I wanted them to hear. Ito ko wala, kung sa ko din mo, tingin na pero, Senate President mo kamsaon, sa lomesa, talmalera tuway, maklong yung lela tuway. Selwan, kukumesingil, rito tula, audior ma, talital nga niya lang, adir ko sisiw. To araw guru la dir, masong sirigit. Kagalaled, hospital, may capacity, adir ko sisiw. Makasay. Ano audior, mata makasay. Adir ko masongos. May site sa quarantine, hotel, marawin, dire ko masong sa recent search. Gitya lo mesen mong dire ko masong sa test kits. Hindi igel si Eden gida, uspe ang esportir, asali, address, mga tmok, hindi mo. Digel ko kumes ko kyung galet tiagi dosa dun ngi lang mong gida dun luar ada belum mo kloro ndira dia kan matapta. Tiga gida masuk di Omicron namal puyul ning mare dun medio tiarak mal mos dia kan salman bosmen kasar mo hospital kasar mo nyuing ya mare dun mo ngin Esen man lungin ngari bladri other below up to orgida namrus. Mako to close se lang dolo ni other below rogu tigel diak lorus pomorus. Ang sopo kli. Tigel ngal diak lorus ngoto siga dule lemrus tirogui. Yeah, that's way. Yeah, our population is very small, so hopefully we can go through this very fast and then get it over with, like you said. Hindi igigid agumdas yung mal-close to sel iled marus tigel diak lorus sel lorus and protector diak protector long protector armigel renal tigel mo odon tira seguida agumdas yung message gira ng murela si saul
Salone Senate President Rate Al. Gotlon Tig, Morar Adrablur Belau, Senator Baules, Akmu Lagom Atakla. Lagom Atak, Rangod al Togoy, Dagl Tod Rang Rirar Adra Public Health. Seguidi Gotlon Tig. Lagom Atakla. Ratogora social media, Mar Adl Masada Togoy Daglod Ngay. Seguidi Amal Imol Long Tig. Ongerum, Dirga katal other belon langwa yobo emos mer dirgak ma yobo ovreor yak malul mitrar bek other belon bol nga ayobo tir ma booster tir ya ongedei yak malul ngit ma bodo mask rogui dige gidi ya untigal mortir
Sula Presidente Talteal, agumdas wen dahil sa kalmamungay ra Yelblado Dr. Robert, Dr. Yano. Dik, tiol talak luwase ngal virus, avec le del buin mo imel buin en chen sabilel. Ya bay lo bay rin lang maliliw dahil sa lobrado del bay. Mang agumdasin sa bay del change ra approach ra del morgi. Ruk mangil luwasen gel mal sumang niya maral may bilel ng obrado maluganda. Del sumang obrado bebira gel gira del momru la gira del momru. Magote Yerogul black ra internet, yerogul tol black ranks. Iral salid mlame help pergida kasi kal Omicron, amiral mera uriu gel mlekot el virus. Mlamornia telal time sa la chen sa bilen. Meron kayiden gel kot el alay tabiler ngi rogul. Maul maknoger cell testing kasi beto ar other sera kayid amle no okra bitar nga ra January 21, 2020. Mga kora Minister Rahel, kora Chief of Staff, kora Vice President lungar aranimong. Sa gidan mer elang, mga sula la Minister Rahel, Raigel Rogul, Blarru. Bebira tayo mga among barel sa kanang mortil, ang aktil gibel, matigil o mesetil moruriw rarbekla. So, apologize si Girel say, hindi hold the commute to higher standard, and that's okay. Dak apologize si Girel. Hindi ka imol adan madra COVID. Yar adan la madra di hutsul se raw lisel beto. In fact, el al week, ikademil di raw Wednesday mo Sunday. Maikarogul to ko agire del malmei e mail do bodo. Lengyagi del Dr. Robert, lengyagi del Dr. Yano, mga kabokser, agir murtal morak munta. Metel berada, to ko luas makim karang. Hindi rogul to ko black to bodo mel mutal el al tutaw. And so all mer madmiu, liberty ang president ra republic, kol president ta senate mas speaker. Ek mo kumilo asal ngari obrado to ko elis del gal maral mel le rulbuil orso. Hindi al tiyagid. Ngari al mutal obrado mo quadra other velo. Hindi nga ko lingit lo asay lagal tiyagid ya muul edom da lo asay hindi al mutal maral me. El lutal maral me ko lingit lo asay Ministry of Health about proactive and rural research 1 week before abol obrado tatoy emergo hido boto mo sambor raw. Tiyagid el experience ada kalungil experience minister. Ngirel ngari adan mungoy ay kal information e predict lo say kadamaral mong mga next tol blok mo ger tinga iliwil lo say ngari a rumors ra delta cron rumors. So hindi ako nilo sa general rumors, hindi there are rumors out there. I'm sure they can tell us about it. Makto ay sila sa tell adi ka last edi adi tiyagi del COVID a prediction na sa ngari mutul bebida outbreak el maral me. Allora al May, ngire la Ministry of Health mo ready. May gal capacity dorul. Hindi to kol marablur elang kasi. Tiang amaral me ngalakal ataw. Hindi kal salmal mo mring la daw. Sedel ngalak keringi. Edo meselo sa selguk maral me ngobrao. Di alsu ngobrao. Ebot alingi sel barao. Makulingit lo ase. Sumaral smeran ngligiw. Makawas me. Labor school, malibel labor maulor, malibel labor turar bebirara, including our mamal tokta, including our regula. Ya ungerung, ulit lo sa iba mo umas. Sirak mer elalsis, I'm sorry not to sit by you, not because you have bad smell. It's because you're wearing the green tag, so that's why I said over here. Because I think we need to send a message to the public, Madra Blue, el wasegel dologoy, agire the practice. Sa ungerung. Ya ungere yilulukoy tiyal turul toktang. Please have mga vaccination. It's not about your right. Hindi ka writer ka versus a writer nga. Gire ra welfare gire ro koy. Masugum ka malmisi all the same say. Nga ka niya writer nga. Yes, marang nga niya writer ka. Tiyal to ka you're a right. You're a safety or other velo. Makulingit lo sa me eda bodo olay gayid eda Marcel Paredel ng talbori obrado del Maralmay kada mamungol ring hindi hal tiyagid sulo.
Ako mesing malamo ko ra gege ma perkreka do president ay gilblado tigal tedel toktang tigal ada CDC ma Ministry Rahel ang yang namo tak mora ada media mama ada olvira rulau no sing ti volti ga gida mo du gida la dosa da kiret ya gida rakta ngir ko bi ada bru ngir ar beklad ngir ko mama onter ngir ngar olvira rulau lo se mem de berem di tigel export tam sauderngi madak teloran me que grey ese ve del gain seu en ala kertial que lo go doctor cuartim tigal toktan tenga la kertian di que grey la tau ya que de bob gikla puntera arada egal state para delegates en brenga sule me sule tigal la ta CDC minister tigal toktan el me el líder aquí de la discusión tira gotten mudur comme cela.
Sulang speaker selbel demonstrating speaker ada kal tertera do mask. Adan diwin. Hindi kadamral kotru ulang sakal dingung tel lemral mera suli rogul toktang. Dr. B, Dr. Hancock, and Dr. Yano, Dr. Roberts, Dr. Cuarte. I count it as a blessing that Palau has this talent and you here to help us through this time. So thank you and pamaral masulang. Pamaral dimra nga sula Dios, dimra nga suliw, dimra nga sula rebek other belaw. Bigidam lot mag dimlak ori mra kada malayo bori. Tolmol marsagi del kaltareng edoru rasel ngar aler de tial luguru matial sa bakla laklang ri da dekal ngar aler la ministry la health ngar aler da rokul. Pardi mukmugi de mal dio ritra abudo ma pertigereng. Kado mask el kado betigaru dara tamata adar bela. Mal misulang ma kotulurio.